And we want to say good morning, Arizona. It is 9:30 on a Thursday morning, and we are starting this half hour with a look at the coronavirus outbreak here at home.
Unfortunately, we know that thousands of people are still getting this virus every single day testing positive.
But there is a glimmer of hope. We have added 3,259 new cases since yesterday, which brings us to a total of 134,613 people to test positive with this virus. Another 58 deaths, unfortunately, reported yesterday as well. So we are now very close to 2,500 people dying from this virus overall. More than 15,000 new tests were reported yesterday, and just about 12.1% of those are coming back positive. Now, that's a slight increase from yesterday of the PCR tests, which are done if you have symptoms. And there was a slight increase in that positive rate overall. The 7-day rolling average, though, of positive tests, they did drop for a 5th straight day, which is the great news that we're talking about. And that's just a sliver of great news. We were at 24.7 yesterday, so it's ticked down just a bit, but we're now at 24%. So frontline workers, they are working around the clock right now, especially in coronavirus hotspots like Arizona. So joining us now is Kimberly Volk, who works in the ICU unit. And are you a nurse?
I actually am an ICU RN, and then I'm also a naturopathic physician.
Okay. I do want to ask you this right off the top because, you know, we all have bad days at work and we go into work, you know, sometimes having bad weeks or bad moments. What is it like for you going in day to day with the state of things going on in Arizona? How do you even get your mind right for this?
Well, I'm lucky enough to only work part-time in the ICU, and I would have to say that over the last 3 to 4 months, it's been very draining. So my coworkers who are working full-time, some are working 5, 6, 12-hour shifts a week. It's exhausting. It's difficult because we are taking care of COVID patients. It's not like we have a variety in the medical ICU that has expanded to over 90 ICU beds. Mm-hmm. They're all for COVID-19. And this virus makes people very hypoxic and for a very great deal length of time. You saw that Governor Ducey talked about the antiviral that is coming to the state to help. But even when someone gets that, it still takes a long recovery.
So let's talk about those ICU beds and the people who are unfortunately having to go into ICU. Do you think we're prepared if there is even another slight uptick in people getting sick?
So the hospitals have been very diligent in watching the numbers, and they have made very definite decisions, such as when they decided to pull back on elective surgeries, not have that to be state mandated, but the hospitals decided that because they had the time to make such a definitive plan. I do watch the Arizona Department of Health, their ICU beds, and we're running about that we only have left in the state approximately 190 ICU beds for the whole state. And that can be concerning. We still have next steps, and the hospitals are just evaluating their patients to see, you know, do we need to make more? How do we make more? The concern is, do you have enough nurses to take care of that?
Yeah.
And we are having consistently more and more crisis nurses coming in and starting to help support us. But we're not the only state. We have several states that are in crisis, where before it was centered around the New York State and New Jersey.
Also, I have to ask you, I mean, every nurse that I've come in contact with and every nurse that I've encountered, whether it's me in the hospital or someone else, you have the best bedside manner. How are you comforting people who you are taking care of, whether they're just in a regular hospital room or the ICU? What can you say to them to make them feel better and to get through the process, hopefully on the better end rather than the worse end of things?
So You are looking to see how you can still make a connection, even though in the COVID-19 isolation rooms, they're all in isolation. So how can you still make connections, even if you're not in that room all the time? And sometimes you are still dressed and gowned, face shield and mask, and sitting in that room and holding their hand just to provide them comfort. Also to look to make them connect with their family, such as iPad use or their phone FaceTime use, to make sure that they can have some kind of connection. Yeah. I would have to say that is the hardest part, is that connection that they have with their family, and that they're being scared because they're so hypoxic.
I cannot imagine the job and the mental that you're going through every day, but I tell you what, we do appreciate you and the rest of your colleagues and all the medical crews who are on the front lines to help us get better, all the people who are going through the hospital. So we appreciate you for what that's worth.
Thank you. People need to understand that it actually starts with them, not with us. So to mask up, hand washing, social distancing, and understand that you might think that family gathering is safe, and it probably isn't.
Yeah, it's great advice.
So to be very conscious about your symptoms, such as I had somebody who, you can be contagious for a long time, and to not ignore your symptoms.
Yeah, it's good advice. You can't warn people enough about this. Thank you so much for giving us a bit of your time today.
All right, thank you.